Hello, I'm Stephanie Stahl, and welcome to Health Watch here on CBS News Philadelphia. Each week we look at the topics that impact you and your family's well-being. Coming up, the measles threat that is growing, and health experts tell us why at least a third of the United States is at risk. And later, we see how a local chef is inspiring others dealing with facial differences. Let's get started.
Nationally, the CDC is warning doctors to be on alert for measles as a growing global threat. Health reporter Stephanie Stahl joins us now with more on worried parents.
There are plenty of them, that's for sure. You know, children cannot be vaccinated against measles until they are age 1, so they're at risk. That's what happened with some of the children infected in the current outbreak. Ready? At 11 months, Ava is too young for the measles vaccine. With 9 confirmed cases in the Philadelphia region, she's potentially at risk in public locations.
I think a lot of parents are concerned and worried about their children's safety.
Ava's mom, Angela Skrinsky, a doctor at Virtua Health, says all her children get the recommended vaccinations. She says guarding against measles is especially important.
You can be spreading measles before you even have symptoms of it.
That's how the Philadelphia outbreak started, according to the health department. A baby too young to be vaccinated traveled internationally and was admitted to CHOP with what at first appeared to be a respiratory infection. By the time the measles rash appeared, the virus had spread to children in nearby rooms.
This is a major event, and you know, it tells us just how fragile that wall of immunity is.
At the height of the outbreak in early January, the Philadelphia Health Commissioner explained how measles cases spread further at a daycare center that she says violated quarantine orders.
This is a very serious, potentially life-threatening virus.
The health department says 93% of Philadelphia children are vaccinated against measles, but vaccination rates are dropping. With 23 cases nationwide in 2 months, the CDC is warning doctors to be on alert.
We are seeing more cases of unimmunized patients and persons spreading disease.
Dr. Selwa Suleiman with Nemours Children's Hospital says the Philadelphia outbreak spread into Delaware with an exposure at Nemours.
Thankfully, the Philadelphia outbreak has not shown any new cases in some time.
Now, the Philadelphia Health Department says after 42 days with no associated new cases of measles, the current outbreak can be declared to officially be over. We hope that happens. I just got in touch with the health department. They say currently no hospitalizations for this measles outbreak.
Good.
So hopefully it'll be over soon.
Indeed. Stephanie, thank you. Now, over time, there have been ups and downs in efforts to get rid of measles.
And can easily spread among unvaccinated people. National investigative correspondent Stephen Stock explains why, right now, at least a third of the United States is at risk.
It started out like any other normal year. Go ahead. You can go.
Also today, a new exposure site. We're told a non-student, non-staffer went there while contagious.
We knew that it was going to be a crisis.
It was a matter of time that our school was going to have a case.
Were you scared?
Terribly. Terrified. Yeah.
This area of the Pacific Northwest is becoming a hotspot for both children suffering from measles and parents who do not want to vaccinate their children.
Clark County, Washington, made national news in 2019 with a measles outbreak that lasted for months.
It was something kind of waiting to happen.
It started with one case.
But you're trying to work as quickly as you can and reach people.
Then came another and another.
Well, there was an exposure there, so they called and let me know.
During the outbreak, Jessica Fitchell's son battled childhood leukemia at just 6 years old.
I distinctly remember being terrified. His life would be in grave danger if he would have been exposed to measles and contracted it.
In a matter of 3 months, the measles outbreak in Clark County had climbed to 71 cases. The rapid spread happened because the number of vaccinated children was well below the minimum level the Centers for Disease Control says is needed to prevent an outbreak.
Herd immunity, simply put, is just the indirect protection to a non-vaccinated person of being surrounded by vaccinated people, right? Those vaccinated people act like a shield.
But in 2019, Clark County, Washington didn't have that shield.
I got an email from the principal that hey, we're having to shut down.
Schools here went to remote learning a year before COVID-19 closed classrooms everywhere. Science teacher William Barr says it could have all been avoided.
I would say that I felt angry, and kind of frustrated that there is this vaccine skepticism.
Nationwide, the share of unvaccinated kindergartners grew significantly in the last 3 years. And in the 19 states where we analyzed data, the vaccination rates are so low, at least 8,595 schools are now at risk of a measles outbreak.
Across the country here in New York City, they had their own measles outbreak in 2019. 649 people in all. Dozens had to be hospitalized.
In the city of New York.
The city's public health commissioner says while more people in New York City got vaccinated because of the outbreak, the numbers have been declining ever since.
I'm worried about the trend if it continues in that direction.
Do you need to be stricter enforcement? Say if you don't have them, you don't go to school, period.
Enforcement and mandates and requirements are useful as a architecture for community engagement.
The reason rates are down is complicated. 6 different experts we talked with point to political influences, misinformation, mistrust in government, and fear of vaccines.
We now have a misinformation superhighway, which is social media, and you can get pretty sophisticated in the ways in which you target misinformation to certain communities.
Another factor, non-medical exemptions for religious or philosophical reasons. CDC reports exemptions were up in 41 states last school year.
Data showed that people in Maine and Vermont and other places were using a religious exemption as a loophole.
The number of parents claiming religious exemptions had climbed so high in Maine 5 years ago, only half the schools had herd immunity. So churches banded together to change the mindset.
For us, it didn't seem radical at all to say, in this instance, the way we love our neighbor is to get vaccinated, to protect the vulnerable, to protect the marginalized, the young, the very old, the sick.
Maine's Council of Churches lobbied state lawmakers to pass a law to get rid of the religious exemptions. As those ended, more schools reached herd immunity.
We came alongside medical organizations, pediatricians organizations, teachers organizations. It was a broad-based coalition of people that joined that coalition to say, here's the right thing to do.
I just can't wrap my head around why you wouldn't do it.
In Jessica's world, the vaccination rate is trending down again.
It's crazy.
2/3 of Washington state schools are now below the threshold for herd immunity. That's 53,000 students at risk.
Why wouldn't you do it for the 5-year-old kid who, if he were to get measles, he's going to die?
Well, just in the last few weeks, 6 more measles cases have popped up in that same part of Washington state. In many states, the public can look up the vaccination rate inside of their schools, but Pennsylvania does not make that information available. And that means that parents have no way of knowing if their child's school could be at risk of an outbreak.
Don't go anywhere. We'll be right back with more Health Watch here on CBS News Philadelphia. Welcome back to Health Watch here on CBS News Philadelphia.
All right, pregnancies that last 9 months are becoming less common, according to new federal research.
This is interesting. Health reporter Stephanie Stahl joining us now to explain this new study. This is not good, I guess, Stephanie.
It's not good. It's a new finding that just came out. You know, doctors say most babies generally need about 40 weeks in the womb to develop fully, so they'll have fewer complications after they're born. Well, that's becoming less common, and it has doctors concerned. Pregnancies are getting shorter. That's according to a new report from the Centers for Disease Control and Prevention. CDC researchers looked at births that happened before full-term pregnancy, around 40 weeks. They found early births at 37 or 38 weeks are up 20% since 2014. Preterm births before 37 weeks are up 12%.
This is concerning because if a baby is born early term, not preterm, but even early term, there can be complications. So the lungs may not be fully developed. That baby may not be able to regulate their temperature or their blood sugar as well. They may not have that suckling reflex that allows the baby to feed. And so that means staying in the hospital for longer so the baby has the support to survive.
Doctors say there are many factors causing the rise in early term births, including obesity, high blood pressure, diabetes, and convenience.
There's no question that some of this is early induction, early C-sections, but the trends of those have actually been going down. While still too high, the trend has been going down over the last 10, 15 years. Complications, things like preeclampsia or eclampsia. These are the reasons women are having to deliver earlier for the health of their own health as well as for the health of the pregnancy.
Doctors say women should not wait until they're pregnant to address issues. They should go into pregnancy as healthy as possible. And doctors say maintaining a healthy pregnancy includes a well-balanced diet, exercise, and maintaining a good weight, and of course, being in regular contact with your doctor.
Yes.
Prenatal visits.
Yeah, so important.
Go stay on top of it.
Thank you very much, Steph. We have an important prescription drug recall to pass along. Azurity Pharmaceuticals has recalled some of its ADHD and narcolepsy medicine, Zenzetti, after a drug different from that ended up in the pill bottle. The company says it issued the recall after some of its Zenzetti tablets had an antihistamine medicine mixed in the package. The recall warned people who take the antihistamine instead of Zenzetti they could experience drowsiness. The company says it has not received any reports of any injuries, but again, take note of that recall.
National Wear Red Day raises awareness about heart disease, the leading killer of American men and women. But women can have different symptoms and outcomes. Health reporter Stephanie Stahl has a story of a Delaware County woman's surprising discovery.
39-year-old Marion Dancy is a mother of 4. In 2019, 6 months after she had her last baby, she started experiencing swelling and extreme fatigue.
I just kept going, and one day I was at work and I got off the elevator and I lost my vision.
A doctor dismissed her symptoms because she had no family history of heart disease.
I had to advocate for my health.
She was diagnosed with peripartum cardiomyopathy, a type of heart failure that happens at the end of pregnancy or after delivery.
I felt like I was going to die.
While peripartum cardiomyopathy is rare according to the American Heart Association, it's more common and deadly among black women.
We're not sure why. It may have to do with genetics, though.
Doctors say women need to be aware of other complications during pregnancy that can have an impact later.
Pregnancy is a form of a stress test for women. If we get high blood pressure in pregnancy or diabetes or have a problem called preeclampsia, that raises your cardiovascular risk in the moment, but it also turns out that it raises your risk down the line for heart disease and stroke.
Marion says she had to change her diet, go to cardiac therapy, and exercise. She also had therapy for her mental health.
I know now that I matter. My health matters.
Important reminders on this National Wear Red Day.
Go Red for Women is really important because women tend to be the caretakers in the family, so they tend not to take care of themselves.
Cardiologist William Gray is with Mainline Health.
We've had a significant reduction in heart disease over the course of the last 40 or 50 years. It's still the #1 killer.
Now, Dr. Gray says controlling your weight and not smoking are critical for preventing heart disease, along with a good diet and regular exercise.
And it's called diet stigma, people being shamed for using weight loss drugs or surgery.
Doctors say that it's a troubling trend that's gaining traction on social media. Health reporter Stephanie Stahl is here to explain.
How mean is that, right?
Yeah,
It's
just
terrible.
do their thing.
You know, when diet and exercise don't work, doctors say some people need medical treatments to lose weight. And they are concerned about diet shaming when people are criticized for not having enough willpower to drop weight on their own. 64-year-old Maritza Cruz struggled with weight her whole life until recently.
Some people don't recognize me.
She tried diet and exercise for years without success. In 2022, her weight was at an all-time high. Doctors said her life was in danger.
If you continue this way, you're not going to make it.
The CDC says more than 40% of Americans are obese, which increases the risk of heart attack, stroke, diabetes, and some cancers. But a recent survey shows more than 61% of people think exercise and diet alone can fix it.
There shouldn't be a stigma. I think the stigma is created by social media.
Doctors say stigma may prevent people from seeking treatment for obesity, and that for many patients, surgery and diabetes drugs for weight loss like Ozempic are key solutions. They carry risks, but experts say chronic obesity is an even bigger danger.
Surgery is definitely not an easy way out. There's a lot more tribulations afterwards that you have to deal with, but the risk mitigates the outcomes issues that you can have without going untreated.
Cruz had bariatric surgery and lost nearly 100 pounds. She's changed her diet, gone through counseling, and now she can exercise and even dance.
For me, this was the best move I've made in many years.
She says her health is what matters, not how she lost the weight. And doctors say people lose more weight with bariatric surgery compared to weight loss drugs, and the surgery has longer lasting results. Both have some potential side effects. And to those diet shamers online, shame on you.
Yeah, it's whatever works for you.
Really.
Whatever you know.
People need to be healthy.
It's a choice, yeah.
If you want to do it, do it.
Yeah.
Whatever it is.
Nobody's
your
business.
That's
That's what we say.
I appreciate it. Thanks,
We're
Jeff.
incensed.
Yeah, that's
do
right.
it. All right, thank you,
We're
Steph.
empowered. Thank you, Jeff.
A new blood test that screens for Alzheimer's may be a step closer to reality. The test measures the levels of protein in the blood, which increases at the same time other damaging proteins build up in people with Alzheimer's. The test could be used to screen for the disease with high accuracy before symptoms even begin to show, according to a new study. Right now, doctors rely on brain scans or spinal taps, which can be costly.
Health Watch will be right back after a short break. Welcome back. Here is more from this week's Health Watch.
Well, a growing number of doctors are using food as medicine.
And health reporter Stephanie Stahl joining us now to explain how this works.
We heard this saying, you are what you eat.
Yes.
Here we go. You know, doctors say that prescription medications are still very critical, but certain food can also play an important role in keeping us healthy.
I'm making a harvest salad.
It may look like the set of a television food show, but Lisa Taylor is a dietitian, and she's preparing healthy dishes at a new teaching kitchen. The lesson that food is medicine.
It means thinking about food and nutrition in the same way that we think about medications and surgery.
Dr. Jacob Mirsky prescribes food to patients. They can get the ingredients at a pantry next door, then sample the dishes made in the kitchen.
Delicioso.
Food is directly related to both the development and progression of chronic diseases, but also can be used to prevent the progression and to treat chronic diseases as well.
Some of these are obvious, like diabetes and heart disease, but doctors say foods high in sugar, salt, and unhealthy fats are directly related to cancer, liver disease, stroke, and more.
Anxiety and depression are also very closely related to nutrition.
These lessons are also available even if you're not a patient through an online cooking class called New Cook. Thousands of people have joined in the classes to cook along with a professional chef and learn the power of nutrition.
You can really make a difference in your health outcomes, in the risk of chronic diseases, by changing what you're eating, how you're looking at food, what you put on your plate.
With a focus on plant-based meals and affordability.
We try to prepare for a family of 4 for less than $20.
It's a good combination for a healthy life. And doctors say there is also data that shows that people who learn about healthy cooking and eating have lower stress levels. I thought it was really interesting what she said, healthy eating, affordability, $20 for a family of 4.
Wow.
So it can be done. You have to be careful about it, but it's doable.
Surviving an horrific accident has inspired a Philadelphia chef to support others living with facial differences.
Health reporter Stephanie Stahl joins us now with his story.
He is a special guy. Wait till you meet him. This chef has some serious injuries to his face, but that hasn't stopped his career or his commitment to helping others. What are you going to make today?
We're going to do a kind of fun escargot dish.
A fun escargot dish? Chef Christopher Kurse, the owner of Forsythia in Old City, loves creating new recipes. Are the flowers edible?
Oh yeah, for sure.
Chef has a speech impediment caused by a serious car accident that happened when he was 16. The lower part of his face was injured, requiring dozens of reconstructive surgeries.
Well, all the stuff I don't remember.
He named this restaurant Forsythia. That's the name of the street where he recovered, watching food shows on TV and cooking for his family.
And then it kind of snowballed.
He's become an acclaimed chef, but he remembers being ridiculed for how he looks, and people still stare at him.
It's not as sensitive, I guess.
So you're not as sensitive emotionally about it?
Yeah.
Hoping to help others and raise awareness, he's now doing fundraisers for an organization called My Face.
You get what you give in the world.
You get what you give in the world? My Face provides a variety of resources that support people with facial differences.
So that they know they're never alone on their journey.
Dina Zuckerberg is the Director of Family Programs at My Face.
We provide support groups for children, adolescents, adults, and parents.
Chef Kurse hopes people learn to not judge others by how they look. For him, it's about creating food happiness. And his food is delicious, the chef says. He has special events to raise money for My Face. We have a link to the organization at cbsphiladelphia.com. A special person, and his first restaurant in Philadelphia was Will BYOB, that lots of people remember in South Philly. Also delicious.
Okay, wow.
Special guy.
Chef, bravo. Yes, indeed.
And helping others.
Good
yes,
for him.
indeed. Bon appetit in every way.
Yes.
Yeah.
Indeed.
Oh, we
Thank
need to
you.
head out there.
Yes, indeed.
Thanks, Steph.
Well, learning how to save a life, it's a new opportunity that's now in North Philly.
Health reporter Stephanie Stahl joins us with the details on the grand opening.
You know, learning how to perform CPR in minutes, it's new technology aimed at helping the 350,000 people who have cardiac arrest each year. The North 10 Lenfest Center in Hunting Park now has a new mobile, hands-only CPR kiosk that trains people how to help someone in cardiac arrest.
Yeah, I think it's a good skill to have.
The kiosk has a touch screen with a video program that instructs users to first call 911, then explains how to press hard and fast on the chest to the music of Staying Alive. 100 to 120 beats a minute.
Within 5 minutes, you can really learn those key elements needed to potentially save a life.
The American Heart Association is teaming up with Jefferson Health to place the kiosk in a community center where anyone can quickly learn what to do if someone goes into cardiac arrest.
The survival rate for out-of-the-hospital cardiac arrest is abysmal, especially, and it is so much better when early bystander CPR occurs.
It helps people to understand how to do something that is so vitally important.
Sponsors say the kiosk is strategically placed in an underserved community where many residents struggle with health complications that increase the risk for cardiac arrest, where CPR training is needed.
We know in communities like North Philadelphia, the statistics for sudden cardiac arrest and bystander intervention are significantly worse than other communities.
Armani Avant is among the first to try the kiosk. That includes a test to make sure people can correctly do CPR. That's all for this episode of Health Watch. If you're enjoying this show, download our app, CBS Philadelphia, on your smart TV, Apple, Roku, or streaming device to catch us every weekend. And stay with us. There is much more to come here on CBS News Philadelphia.